We have everything on par.
We're good.
So, Miss Jamie, thank you so much for being brave to do this piece of work with me so that we can share with other EMDR therapists, the appropriate protocols, how to set something up from presenting information and taking that presenting information and putting it into the standard protocol and doing a target in a session. That's what we're trying to show we can do today with an explicit memory that is rooted more in fear and less in shame. We're not working on attachment stuff. We're going to model some 2.0 strategies as well. So deviating a little bit from standard BLS, which is what we all learn in basic training. And we're going to talk about, we're going to do some ways to modify that a little bit to decrease the stress in processing and hopefully accelerate the processing of it. So thank you for doing this with us.
Yeah, I'm excited.
And I think that we can share this with people and hopefully they learn a lot from it. So, or at least have a sample that we can see. And also for our clients who are nervous about what is EMDR going to be like and what can we expect when we choose to do EMDR, to be able to have a little bit of a snapshot about what it might look like if we are a client. So this will hopefully serve a few purposes.
Yes.
So again, I'm excited to have you here and hopefully we find it a beneficial experience, both of us. So tell me a little bit about what you'd like to work on today.
Yes. So I experienced a couple months ago a chemical pregnancy. My husband and I have been trying to conceive for several years and started the IVF process about a year ago. And so we had our first IVF transfer and it resulted in a positive pregnancy test, but my levels were so low that the pregnancy didn't stick. And so that brought up a lot of really sadness and grief.
Right. And
some kind of feelings of being broken or defective in some way.
Yeah. And is this your first pregnancy? Have you had other children? You ever been pregnant before? Can you tell me a little bit about your history on this topic?
Yeah. So I have been pregnant once before this. That was a result of an IUI procedure that we did. I miscarried that pregnancy at about 7 or 8 weeks.
Okay.
Before that, I had never experienced a pregnancy.
Okay.
And that was about a year and a couple months ago.
Okay. And have you done any EMDR processing on that other miscarriage?
I did.
Okay.
Yeah, I did.
Okay. When you had the recent chemical pregnancy, did you notice any feeling flashbacks at all from the previous miscarriage? Can you recall that?
Yeah. I think I wouldn't call them flashbacks. I did have a sense of this general sort of like it's taken this long, this combined with that must mean there's something wrong with my body, really. So it sort of is, it does feel kind of all meshed together.
Okay. And, you spoke to me before about this being longer than 3 months ago, this chemical pregnancy, which indicates we would want to use a standard protocol. If it's sooner or more recent than 3 months, we would want to use a more recent incident protocol like RTEP or something like that. But since this event was more than 3 months ago, we'll use the standard protocol for this. I wanted to, just make sure you feel okay doing this with me. And, it's sensitive material. And I know that, you have choices and you don't have to do this. And I have no expectations about any of that. So I just want to really make sure you're checking in with yourself in this moment and that it feels all right,
Yeah.
to do a little bit of work with me on this.
It does.
Okay.
Yeah. It feels good.
Okay. So I'm going to go ahead and, I know you have good resources. I know you have strong supports. I know you have a consistent therapist. So I feel comfortable just, inviting you to do this piece of work with me and not doing a really elaborate, history taking. I think that's not necessary for today. But a little bit of history around the getting pregnant, I think is probably important just in case something comes up that I can use as an interweave that might help.
Okay, great.
So I'm wondering, regarding the history of trying to get pregnant, do you mind sharing a little bit with me about what that's been like and what you've learned along the way? You don't have to go into great detail, but just a little bit to help me understand what brought you to, medical interventions and things like that.
Sure. Yeah. So my husband and I went off birth control in 2018. And I started tracking my cycles. And so we were doing like timed intercourse and, it didn't happen and, it just kept not happening. And, it was interesting. My mind flashed back to when I was a teenager. My friends and I would always talk about, well, what if one day I can't get pregnant? Right. And that was like the big fear or one of my big fears, was this idea that you'd, get married and go off and want to have a baby and feel stuck, or not be able to. And, I think that even predates back to being a little kid and having babies and carrying around babies in strollers and as a 2-year-old, it just feels so, ingrained for me. And so it didn't happen. And I knew that was a possibility, but, after about 2 years, I would say, I started to get worried. And that's when we pursued a fertility clinic. That experience was good. They said, you look great. Like your anatomy is fine. And, so we'll start pursuing like some intervention, some medical support with it. So it felt a little bit like my biggest fear happening. Right. But there is still a part of me that's hopeful.
Good. Because you're kind of early in this part of the journey, and I think hope is a really powerful emotion that can change a lot in a body to produce, a different outcome in the future at some point. So by doing this today, what is your hope? Like when we think about present triggers, what comes up for you around current present triggers and makes you decide, I think we should do this piece of work today? What would you say are some current present triggers?
Just fear about trying again, feeling fearful instead of joyful if I do get pregnant again. And, there's a lot of responsibility. And so I think one of the biggest things is this idea that because I'm guarded, that will somehow impact my ability to get pregnant or to carry a healthy pregnancy because I'm so scared of it.
Right.
So I want to be open.
Right. So you ultimately want to be able to remove this fear and the feelings associated with these two, failed attempts at getting pregnant, with some medical interventions so that you can get your body into a place where it can more openly receive the potential and the opportunity to become pregnant and carry that pregnancy to term. And so what I'm hearing you say is you don't want your fear about what's happened to sabotage the possibility of it not continuing to happen.
Exactly.
Awesome. That's great insight. And I think really, it's all we can do, you know, and also it's really scary because although the guard isn't going to protect you, if it happens again, it also isn't going to contribute to it not happening again.
Yeah.
Right.
Yeah. I know that it's best to not be guarded,
Mm-hmm.
and the pain of feeling excited and then having that taken away feels
Mm-hmm.
so great.
Yeah.
That it feels almost impossible to not be guarded.
Yeah.
But I want that experience to be
Mm-hmm.
a joyful,
right,
exciting time.
Right. Well, let's see what we can do to kind of bring down that guard,
Okay.
that part of you that's resistant to being open and hopeful all the way, because you've been through a couple of things that kind of have dampened that possibility of hope. Because when it's happened to somebody, what if it happens again is what our bodies do. What if it happens again, and how do I tolerate that?
Yeah.
And so I think it makes a lot of sense. And so it's brave to want to get the guard down, because it will probably feel more vulnerable if it does happen again.
Yeah.
But at the same time, the odds of it happening again are much greater if we don't have all that energy in our system that's full of fear. So let's go for it.
Okay.
So when you said present triggers, you feeling fearful, and then being afraid that you won't experience joy when you do finally get pregnant because the fear will override it. So it's like a thought that happens. It's not necessarily something that's happening around you, but it's a thought that's triggering. If I imagine myself pregnant again, will I be able to feel joy? And then you talked a lot about responsibility and kind of feeling defective or broken. So, it may be that, but I'm also hearing a lot of powerlessness. Like, I can't control
Yeah.
works. And I see your eyes change a little bit when I say the
Yeah.
powerless piece. So we'll have to check in and make sure we get the right side, because a lot of times we do this work and we think we've cleared something, but we've maybe only cleared one of the negative cognitions around the topic.
Right.
And it oftentimes gets interweaved with more than one domain. And so, as I noticed your eyes change, I think you probably did do the work to whatever was available around the last miscarriage, but the powerlessness about what could happen in the future may or may not have been addressed. I don't know. So we'll have to just check in and see what happens. Okay.
Okay.
All right.
Sounds good.
So when you think about this recent chemical pregnancy, if you kind of close your eyes and you tune into that, can you get a snapshot or a moment that is an image that represents the worst part for you?
Yeah. We knew that it was a boy embryo that we transferred.
Okay.
And that's the most painful part. I picture just a little boy with my husband.
So it's the picture of what could have been, and already feeling such exquisite loss because of what our mind will do for us to create hope. And so you already have an image and a picture of what it would be. So it's the picture is having seen it already and then losing it. And when you think of that picture, what's the negative belief you have about yourself?
I'm defective.
Okay. And can you get in touch with the emotions that you're experiencing as you think about that?
I think the most overwhelming one is grief.
And can you feel it in your body?
Yeah. It's like right here in my chest.
So just to make sure we're checking our work, let's go ahead and do a float back.
Okay.
I want you to really tune into that space in your stomach and that deep grief that's coming up for you. And those words, I'm defective. As you hold those things together, I'm just going to have you float back to other times in your life where this feels familiar. And you can just tell me briefly age and event if anything's coming up as you float back.
I can't seem to find an earlier experience that led to this kind of feeling.
But did you come up with anything that felt familiar, even if it's not a similar event, if that makes sense? Because sometimes our emotions or that space in your stomach are the only sensory input that will tie it together. And I just want to be certain there's not something before that made you feel like somehow you fell short and that created this grief or loss in that pit in your stomach.
Mm-hmm. So my mind, or maybe my body, goes to when I was really young, I think about 5, some stuff around my parents' divorce. Maybe like internalizing.
Yeah. A lot of kids get, maybe if I had just done better, they wouldn't be doing this.
Yeah.
It's pretty common. You were so little. No frame of reference but self at that point.
Yeah.
Yeah. Can you feel that?
Yeah.
So we get to make a decision. We can work on that and set up a target on that, and it will maybe likely generalize into this current defectiveness grief stuff, and we can check our work to make sure it does, or we can keep on that present memory and the miscarriages specifically. It's up to you. You can check with your body to see what feels the best for you to do.
The recent experience definitely feels sharper.
Okay.
Yeah.
Okay.
But I'm open.
Okay. Well, we can kind of check our work because it might reverse generalize too if you want to stick with the sharper, more recent feelings.
Yeah.
And maybe even just talking about that will help it kind of go there anyway if it needs to. But if not, I recommend we look back at doing that piece, or that you take that to your therapist just to make sure, because we know there was information stored there, or you wouldn't have gone there.
Yeah.
So it's not fully resolved.
Yeah.
Either way. So we should just make sure we're thorough and check our work.
Okay. Sounds good. Yeah.
So when you think about the recent chemical pregnancy, does that memory feel stronger or more sharp, or the miscarriage that happened before, as you kind of put them both in your...
Yeah, I think definitely the chemical pregnancy feels...
Okay, so when you think of that chemical pregnancy, you had said that the negative belief was, I'm defective. Well, what would you rather believe instead about yourself when you think of that picture of it was a boy, and I think of that boy with my husband, and it didn't happen in the grief? What would you rather think about yourself?
I'm valuable.
And when you think of that picture and the words "invaluable," that picture of the way that could have been in your husband, how true does that feel, where 1 is not true and 7 is all the way true and valuable? Okay. And the emotions that are coming up now as you think about it are what?
Grief. Just sadness.
You don't have any guilt around it. Ask your body, not your head. I know your head knows the truth, but because we found that 5-year-old memory, I just want to make sure there's not something in your body that says maybe it was.
Yeah, there's some guilt.
And where in your body do you feel this right now? Or sorry, how disturbing are the emotions on a scale of 0 to 10, where 0 is not at all and 10 is the worst you can imagine when you think about this image and the words and defective and the grief and the sadness and the guilt?
I'd say it's a 6.
And you had said you felt it in your stomach. Is there anywhere else that you feel it as well?
It's like right here, yeah. Pit of my stomach.
So I'm going to start with more of a standard BLS, but I'm going to modify it as I kind of notice if we're having more trouble getting in there.
Okay.
Because you were really transparent about that guard, so I want to make sure we identify it if it's helping you out a little too much.
Okay, sounds good.
All right, so I want you to just notice that image that we just talked about. The little boy and your husband. And those words are defective. And the grief and the guilt and the sadness. And that deep pit in your stomach. You have that all together. Enough. Right? You tap twice on your left knee and 3 times on your right and keep that up. Take a deep breath. What did you get?
I noticed sensations moving around in my body. And I was able to picture the image, but it felt a little less vivid, a little less sharp.
So if you close your eyes, just kind of tune in. What's there now?
There's still a sensation there. It's like tingling.
Okay. Just notice that sensation. See what comes up. Be curious what it might be. Still hold it. Go ahead and name things in the ocean.
Fish, dolphins, whales, sharks, turtles, seals, sea, plastic, unfortunately.
Take a deep breath. What do you get now?
it was harder to connect with that experience. But my body feels pretty hot.
Some energy there.
Yeah.
So I'm going to have you close your eyes and tune into the heat. And going back to whatever's left of that image, be curious what point in the image or memory or anything else that's kind of coming up that seems to be connected to that heat.
I think of this picture I have of my husband holding a baby. It's his nephew. And just wanting him to be a dad.
Say hip hop, zigzag, tick tock.
Hip hop, zigzag.
Keep saying it.
Hip hop, zigzag. Zigzag, tick tock, hip hop, zigzag, tick tock, hip hop, zigzag, tick tock. Just feel sad.
Okay to let yourself I'm so sorry. Let it out. There you go. Name foods we eat at the holidays, Christmas.
And mashed potatoes, cranberries, green beans, gravy, thought of this happy memory of my husband when he was hospitalized recently. And I came to visit him. Obviously, I showed up, and the first thing he said was, "Am I in heaven? Because you look like an angel." And he was just being his goofy self. But I just thought of like how much he loves me.
How valuable you are today. You're his angel. And then snap twice on the left and once on the right. What did you notice?
I just felt a lot of love for him. And I do know that we'll be parents and that he's going to be a great dad.
You're going to be a great mom.
Thank you.
So when you go back to the memory we started with, can you just check in and see where we're at? See what it looks like now.
Feels like I'm seeing the future image now.
What do you see?
I see him holding baby. And it feels like reachable or like possible.
Yes. And the memory we started with, can you tell if there's any disturbance left?
It's not. It feels exciting. It feels like it's going to happen for us.
So on a scale of 0 to 10, where 0 is no disturbance at all and 10 is the greatest you can imagine, what would you say this memory we're working on is at right now?
This is 0. It feels positive.
Okay. And the belief you said you wanted about yourself was I'm valuable. Is that still the belief we want?
I think so.
Okay. May I offer a potential up the ante?
Yeah.
I'm valuable and I can be helpful. Or I'm valuable and I don't need to be afraid. What do you think?
I like that. I noticed stuff happens.
Okay. So we got a little more work to do, but we want that, right? Because what you said you wanted is to not have to be afraid.
Yeah.
And so we need to remove any part of you that is still holding on to the fear of the future, because you have this beautiful future image. We don't want to be able to be like this still, right?
Yeah.
So does that feel okay to you to change that? Because it's your decision.
But it does.
Yeah. So I'm valuable and I don't have to be afraid.
Yeah. I can be helpful.
Okay. I'm valuable and I can be helpful. Which hope is kind of the absence of fear.
Yeah. Yeah.
Okay. So when you think of the picture now and the words I'm valuable and I can be helpful, How true is that where 1 is not true and 7 is completely true?
It's 6.
Okay. Let's go ahead and pair up those words. We had a little somatic tell, so we know we got a little more work to do. So pair up those words. I'm valuable and I can be hopeful. And whatever that image holds now. Desert critters.
Loneliness. Birds. Snakes. Kindness. Feels true. Feels like the only way to be. So,
Right on. So 1 to 7, I'm valuable and I can be hopeful. And we'll go ahead and we'll do a body scan. So I'm going to have you pair up whatever's left of that memory now, whatever it looks like now. I know that it's changed quite a bit in those words. I'm valuable and I can be hopeful. And I'm going to have you scan from the top of your head to the bottom of your feet, noticing any tightness, tingling, or tension. Information for us to make sure we're thorough.
feel good. I just feel open.
Nice. So I would say that's a complete target.
Thank you.
We've got a chance for we have 10 minutes to make sure you can get out of here on time. Would you like to do a quick feature template?
Sure.
Okay. So I want you to imagine a video or an image or I want you to play a video of something in the future that might create some anxiety around this topic. Kind of think about what that might be. And maybe imagining getting pregnant, being pregnant again. And we can do some desensitization on this feature template. I want you to just, when you have a video or, a future memory that could happen, and you can see it from start to finish, I want you to we're going to play that video while I do BLS, and we're just going to make sure we get anything that might be in the future template and do the anxiety before it happens, perhaps. Let's just see. Do you have one?
Yeah.
Okay. So you ready? Mm-hmm. And you tell me when you're through it. Okay. If there's any tough spots, we can stop and check. it go?
Yeah, I imagined getting a call that I am pregnant after doing that, and like jumping into my husband's arms and getting excited. And then I thought of what would normally be a really scary few weeks after that, but just like prioritizing ourselves, like going on a van trip. My husband's building a camper van, so like just doing things and connecting, not being scary.
And taking care of yourself.
Yeah.
Yeah. Was there any anxiety or anything that came up that we need to just hit again?
Not really. It just felt exciting.
So I want to play it again.
Okay.
And if you need to modify anything, you can.
Okay.
I want to make sure we just are really thorough.
Okay.
And I like to usually run a feature template at least 2 to 3 times. So
Okay.
just to be sure. Because sometimes stuff comes up that you didn't know. So yeah. So play the movie again.
I just feel like so much love for him. Like that's going to be just such a I don't know, like a time to turn toward each other and get to experience something exciting that's about the two of us.
So special.
Yeah.
Wonderful. How do you feel?
Good. I feel a lot more open.
And what's the takeaway for you today after this piece of work we did?
I think just that, like, my value is separate from that. Like, even if it never happened, I'm still valuable, and my husband and I would still figure something out. But that it's also possible. I feel like doesn't feel so far out of reach.
Well, thank you so much for being brave and doing this with me. And it's been an honor, truly. And so thank you for that.
Thank you so much. I can't thank you enough.